They're small green and often hailed as a superfood. But could these so-called health boosters actually be setting you up for a silent health crisis? You've probably seen pumpkin seeds topping salads, blending into smoothies, or packaged in health food aisles labeled as rich in antioxidants, high in zinc, or great for your heart. It all sounds good until it isn't. Behind their seemingly harmless shell lies a truth most people, especially older adults, are never told. It's the kind of oversight that doesn't make headlines, yet it can have lasting consequences on your health and quality of life. One moment you're thinking you're making a smart dietary choice, the next, you're grappling with unexplained fatigue, worsening blood pressure, or digestive discomfort that you can't quite trace back to a cause. For seniors who are already navigating chronic health conditions, the difference between nutritious and dangerous can be just one handful away. This isn't fear-mongering. It's a warning born from clinical experience and research that too often gets buried beneath the noise of health trends and superfood marketing. While pumpkin seeds can be incredibly beneficial, there are critical scenarios where they may do more harm than good, especially if you're over the age of 60 and managing conditions like kidney disease, thyroid dysfunction, or hypertension. Today, we're pulling back the curtain on when and how these seeds can quietly sabotage your health. We'll explore overlooked risks, common mistakes, and essential guidelines every older adult should follow before embracing pumpkin seeds as a staple in their diet. Let's dive into the lesser-known dangers of pumpkin seeds and, more importantly, how to protect yourself while still enjoying their many potential benefits. The kidney complication. When phosphorus becomes a problem, pumpkin seeds are a potent source of phosphorus, offering over 33% of the daily recommended intake in a single ounce. That's a good thing, right? Not necessarily for older adults, particularly those with chronic kidney disease CKD or declining kidney function due to age. This abundance becomes a problem. As kidney efficiency decreases, the body loses its ability to filter out excess phosphorus from the bloodstream. This results in elevated phosphorus levels, which can lead to dangerous complications, including calcium deposits in blood vessels and vital organs like the heart and lungs. One of my former patients, a 74-year-old retired teacher, came to me after experiencing leg cramps, fatigue, and irregular heart rhythms. She was in the early stages of kidney dysfunction, but had recently begun eating 2 tablespoons of roasted pumpkin seeds each morning with breakfast, believing it would help her joint pain. Her blood tests showed phosphorus levels well beyond the safe range. With the seeds removed from her diet and her phosphorus intake adjusted, her symptoms gradually subsided. According to the Centers for Disease Control and Prevention, CDC, over 15% of U.S. adults are affected by CKD, and this number increases significantly with age. Seniors must be cautious with foods high in phosphorus, even if they're natural. Just because a nutrient comes from a plant source doesn't make it universally safe. The solution: older adults with known or suspected kidney issues should limit pumpkin seed consumption to no more than 1 teaspoon per day unless cleared by a nephrologist. More importantly, regular blood tests for phosphorus levels should be part of any senior's health plan if seeds or nuts are a common part of their diet. Dangerous interactions. Pumpkin seeds and blood-thinning medications. It's widely known that omega-3 fatty acids, which are present in pumpkin seeds, support cardiovascular health by reducing inflammation and lowering blood pressure. What's less known is how these same components can interfere with medications that many seniors depend on. If you're taking anticoagulants commonly known as blood thinners like warfarin, apixaban, or clopidogrel, you're already at increased risk of bleeding. Adding large amounts of pumpkin seeds to your diet can unintentionally enhance this effect. The vitamin E and omega-3s in the seeds have mild blood-thinning properties of their own. In combination with your prescription, this can tip the scale from therapeutic to dangerous. Take the case of Mr. Dalton, a 69-year-old man with a history of atrial fibrillation. He was on a low dose of warfarin to reduce his risk of stroke. Believing he was making a heart-smart choice, he began incorporating pumpkin seeds into his afternoon yogurt every day. Within weeks, he developed unexplained bruising on his arms and legs. Blood tests confirmed his INR, a measure of blood clotting, was elevated far beyond the safe range. Research from the Journal of Clinical Pharmacy and Therapeutics underscores this risk, noting that even foods with moderate anticoagulant effects can amplify prescription drug activity when consumed regularly. The takeaway is simple. If you are on blood thinners, treat pumpkin seeds as you would any medication with measured caution. Always discuss new dietary additions with your healthcare provider and monitor for any changes in bleeding, bruising, or energy levels. Thyroid function at risk. The zinc and selenium dilemma. Zinc and selenium are essential minerals found in pumpkin seeds, and both play an important role in immune system support and thyroid hormone production. But there's a catch: too much of a good thing can disrupt the delicate balance of your endocrine system. Seniors with thyroid conditions, particularly hypothyroidism or Hashimoto's thyroiditis, need to monitor their intake of these minerals closely. An overabundance of zinc can inhibit the absorption of copper, leading to an imbalance that can slow metabolic function. Similarly, excessive selenium, while rare from food sources, has been linked to a condition called selenosis, which impairs thyroid hormone conversion. For seniors, taking levothyroxine timing also matters. If pumpkin seeds are eaten too close to medication intake, they can interfere with the absorption of the drug, making it less effective and leaving symptoms like fatigue, cold, intolerance, and weight gain unresolved. As a best practice, seniors should avoid eating pumpkin seeds within 2 to 4 hours of taking thyroid medications. Pairing them with iodine-rich foods like seaweed or dairy products can help maintain hormonal balance and support thyroid health. Digestive discomfort, a hidden problem for aging. Guts pumpkin seeds are high in fiber, a great trait for digestive regularity, right? For some people, yes. But for older adults with slower digestion or gut sensitivity, this can create unexpected problems. Fiber is difficult to digest, and the hard outer shell of unpeeled pumpkin seeds can act as an irritant, particularly for seniors with diverticulitis IBS or reduced stomach acid production. The result: bloating, gas, abdominal discomfort, and irregular bowel habits. A retired nurse I worked with, age 67, swore by a new diet she had adopted, which included homemade granola with raw pumpkin seeds. After several weeks, she developed persistent bloating and cramps that she couldn't explain. After eliminating the seeds and switching to soaked, peeled versions in small quantities, her symptoms improved dramatically. To ease digestion, pumpkin seeds should be soaked for at least 6 to 8 hours before eating. This process breaks down phytic acid, a naturally occurring compound that can block the absorption of minerals like magnesium and iron, and makes the seeds softer and easier to process. Avoid eating seeds on an empty stomach and always chew thoroughly. For seniors with ongoing digestive concerns, it may be best to consume pumpkin seeds in powder form or blended into soups to minimize irritation. Calorie overload, a hidden threat to weight management. For seniors striving to maintain a healthy weight or manage metabolic conditions like type 2 diabetes, pumpkin seeds can be deceptively counterproductive. Though nutrient-dense, they are also highly caloric. Just 100 grams of pumpkin seeds contain nearly 600 calories and around 50 grams of fat. For older adults whose caloric needs decrease with age and reduced activity levels, these numbers can quickly derail health goals. Unlike sugary snacks or fried foods, pumpkin seeds often escape scrutiny due to their superfood reputation. But the reality is mindlessly snacking on them while watching TV or adding multiple tablespoons to meals can lead to an unintentional caloric surplus. This is particularly problematic for individuals trying to control blood sugar or reduce abdominal fat, two critical factors in senior health. A clinical case involved a 66-year-old woman managing prediabetes and mild obesity. She replaced processed snacks with what she believed were healthier alternatives, including daily portions of pumpkin seeds. Her weight continued to rise and her blood sugar readings fluctuated. When we reviewed her dietary logs, it became clear she was consuming over 300 additional calories a day just from seeds. A modest cutback in calorie adjustment helped stabilize her health within weeks. Portion control is key. 1 to 2 tablespoons per day is generally safe for most seniors. Measure servings intentionally rather than eating directly from a bag, and integrate them into meals instead of using them as standalone snacks. Combine with high-fiber vegetables or lean protein to maintain satiety without overconsumption. The blood pressure paradox. When heart health hurts, pumpkin seeds are naturally rich in potassium and magnesium minerals known to support heart function and lower blood pressure. For most people, this is a health benefit. But for seniors already experiencing hypotension, low blood pressure, this effect can be harmful. The danger lies in compounding effects. If you are already on antihypertensive medications, adding high potassium foods like pumpkin seeds may lower your blood pressure too much. Symptoms may include dizziness, fainting, or fatigue, which can lead to falls and other injuries that are particularly dangerous in later life. According to the National Institute on Aging, approximately 30% of adults over 65 experience at least one fall annually, and low blood pressure is a contributing factor. While pumpkin seeds alone aren't usually the sole cause, they can contribute to cumulative effects when paired with blood pressure medications, fluid imbalances, or other heart-healthy diets that include potassium-rich foods. If you have a history of hypotension or are taking medication to manage your blood pressure, speak to your healthcare provider before incorporating pumpkin seeds regularly. Monitor your blood pressure frequently and look for any signs of overcorrection, such as feeling faint or weak after eating. Liver stress and nutrient overload. The liver is the body's detox center, breaking down fats, filtering blood, and metabolizing medications. While pumpkin seeds contain beneficial fatty acids and antioxidants that may support liver function in moderation, excessive intake can contribute to liver stress, especially in individuals with fatty liver disease, hepatitis, or a history of alcohol use. Fatty liver disease is one of the most common liver conditions among older adults, often going unnoticed until damage becomes severe. The accumulation of dietary fats, even from healthy sources like seeds and nuts, can contribute to this burden. Over time, this can lead to elevated liver enzymes, inflammation, and in worst cases, scarring or cirrhosis. One senior client of mine, a 71-year-old man who had battled non-alcoholic fatty liver disease for over a decade, introduced pumpkin seed oil into his diet as a supplement. Within 3 months, his liver enzyme levels, previously stable, began to rise. While the oil wasn't solely to blame, we determined that the concentrated fat content from both his supplement and seed intake needed to be reduced to prevent further damage. Seniors with liver conditions should consume pumpkin seeds in strict moderation and avoid high-fat versions like seed oil unless cleared by a hepatologist. A diverse diet with controlled fat intake and a variety of nutrient sources will provide better long-term liver support. The nutrient absorption issue. When seeds block the good stuff, pumpkin seeds contain phytic acid, a compound that in large amounts binds to minerals like magnesium, calcium, and iron, reducing their absorption in the digestive tract. This is particularly important for older adults who are more likely to experience mineral deficiencies due to medication use, reduced appetite, or malabsorption. While the phytic acid content in a small amount of seeds is unlikely to cause serious problems, regular high consumption without proper preparation, like soaking or sprouting, may impair long-term nutrient status. This was evident in a 70-year-old woman I worked with who was dealing with iron deficiency anemia. Despite a diet high in iron-rich foods, her iron levels remained low. Upon evaluation, we found she was eating raw, unsoaked pumpkin seeds daily. After switching to soaked seeds and adding vitamin C-rich foods to her meals, her iron absorption improved and her levels normalized within 2 months. Soaking or roasting pumpkin seeds can reduce their phytic acid content and make their nutrients more bioavailable. Eating them with foods high in vitamin C like citrus fruits or bell peppers can further enhance iron absorption. Safe practices for seniors. Guidelines for enjoying pumpkin seeds. Responsibly, pumpkin seeds can be part of a balanced diet for seniors, but only with a careful, informed approach. Here are a few universal best practices. Limit intake to 1 to 2 tablespoons per day unless otherwise advised by a medical professional. Always chew thoroughly, especially if eating seeds with a shell. Soak seeds overnight to reduce phytic acid and improve digestion. Avoid raw store-bought seeds with additives, salt, or sugar. Check interactions with medications, especially blood thinners or blood pressure drugs. Separate consumption from medications like levothyroxine by several hours. Pair seeds with vitamin C foods to maximize nutrient absorption. Store properly in airtight containers in cool, dry environments to prevent spoilage. Every senior's health profile is different. Personalized medical advice should always guide your dietary choices, even with something as seemingly harmless as seeds. Conclusion: pumpkin seeds are not the enemy. In fact, they offer a range of health benefits that are especially valuable for older adults, from boosting immunity and supporting prostate health to providing essential micronutrients. But they are not a one-size-fits-all solution, and in certain situations, they can silently work against your health. As a senior care professional, I've seen firsthand how easy it is for well-intentioned habits to turn into unintended health setbacks. What matters most is context. Your medications, your medical history, and your nutritional needs all play a role in determining whether pumpkin seeds are a help or a hazard. Awareness is your best defense. By understanding the risks and taking steps to mitigate them, you can make smarter dietary choices that support your health rather than complicate it. Eat thoughtfully, monitor your body's response, and never assume that what works for one person will work for all, especially in the later decades of life. Balance and knowledge are the real superfoods. Respect your body's changing needs and approach every food choice with intention. If you found this article helpful and want more evidence-based advice to support a longer, healthier life, don't forget to like this article and subscribe to the Longevity Secret channel. Join our community of informed, empowered seniors taking proactive steps toward better living every day.